Well, this month marks 1 year since South Georgia Medical Center received confirmation of its first COVID-19 patient.
WALB News 10's Jennifer Morejon joins us live after speaking with two nurses who have worked on the front line since the beginning.
Jim, I asked the two nurses to describe to me in just a few words what their experience has been like. They tell me fearful, emotionally draining, and now grateful.
But I've had several that I've had to stand at the bedside or be on a Facetime while the family literally watched the patient breathe their last breath, and you're standing there holding a phone for the family to witness that. And that's kind of hard to do when you're the only person in the room with a dying person that you're not even family.
Gina Colson is the registered nurse in charge in the intensive care unit. Shemika Moss works in the Med-Surg Unit. They care for stable COVID-19 patients. The two say no one could have been prepared for this pandemic.
We've seen a lot of death, a lot of pain, a lot of suffering, and probably one of the hardest parts was most of this time there was absolutely no family involvement at the bedside, which is very new for us.
Colson says she was there when the first patient came in. They had no idea what the patient had. She was taken to another hospital.
You know, it was scary, but we had no idea what was coming down the line. It was real at that point, but nowhere near as real as it got whenever our whole unit was full of 24 beds of COVID positive patients who were sick, dying, and we were in a helpless state in some situations where nothing we were doing for these patients was making a difference.
Colson says her floor was full the next 6 to 8 months.
We would call these families, try to give them some hope. When in your heart you knew there wasn't a lot to give them, but you try to tell them something they could hang on to.
Many patients came from miles away and were all different ages.
Just connecting to these people, because
you're their only family when they're here a lot of times, especially when they're on her floor.
They tell me there's many stories and people that will stick with them forever.
There's always that ray of sunshine that comes through, so that's what we do it for. You never know when that's going to be the one that's going to, when you think they're not going to make it, they're going to come out from the brinks of death, and then they're going to be able to come back and thank us for it.
1 year later, they're glad to have a vaccine. For the next 30 days, the Dasher Memorial Heart Center will glow blue, the color of hope to many, as a display of respect and strength. They say they've learned life is shorter than what we think and never take things for granted. In Valdosta, Jennifer Morejon, WALB News 10.